The Vacora vacuum-assisted breast biopsy system is indicated to provide breast tissue for histological examination with partial or complete removal of the imaged abnormality. The system is completely self-contained to include the vacuum source and all tubing. 14-gauge and 10-gauge biopsy probes are available in 2 lengths. The following procedure is an MRI-guided breast biopsy procedure using the Vacora biopsy system.
My name is Jennifer Cranny. I'm a radiologist with Imaging Specialists of Charleston, here in Charleston, South Carolina. I will be doing an MRI-guided breast biopsy for a right breast lesion today. We use the Siemens 3 Tesla variomagnet at our imaging center, and I'll be using the barred Vacora device for the biopsy. Okay, I'll be setting up the tray for the biopsy. The tray comes pre-made with syringes and a scalpel and needles. We drop 1 cc of sodium bicarbonate for the skin, and that's mixed with lidocaine. And for the deeper tissues, we use lidocaine and epinephrine. And now we'll open up the coaxial needle. And this set comes with the grid block in it. After we image the breast and decide on the depth that we need, we'll put the stopper at the depth that the computer gives us. It also comes with a plastic inner stylet for imaging. This is the needle we use to biopsy, and we just put this inside of the device. And after the end of the procedure, we put a clip in place to mark the area.
The patient is lying on her stomach. Gadolinium is used as a contrast agent and is delivered intravenously. The breast is positioned within the coil. The grid plate compresses the breast to hold it in place. The breast should be firm but not too tight because you don't want to cut off the blood flow. When we're in a good position, we then do a preliminary scan.
When we do an MRI-guided biopsy, we position the patient in the breast coil with a grid in place. We image in a sagittal plane, and you can see on this first image the grid in place at the edge of the breast. We use the DynaCAD system, and it finds these fiducial markers which are filled with contrast. The computer automatically finds these markers. When we know that the computer has found them adequately, then we give the patient contrast and we re-image in the axial plane. On this view, you can see the axial plane. When we find the lesion, we place our marker on the lesion, and it automatically detects where the lesion is in the sagittal view. Down here, the computer automatically tells us which box to put our grid needle holder, and it tells us which hole to use in the needle holder. It also gives us automatically the depth on our coaxial.
Clean the skin off in that block using betadine. Numb the skin in that area with lidocaine, and then deeper with lidocaine and epinephrine. Make an incision with an 11-blade knife and hub the knife. Set the depth stop on the coaxial cannula. Now we're ready to place the coaxial cannula.
DynaCAD told me that my needle goes at the C1 location of the grid block, which is A, B, C, and 1.
Locate the correct grid location as calculated. Next, remove the titanium stylet and replace it with the plastic stylet so that we can image.
We've placed the coaxial device and we're imaging the patient with the plastic stylet in place. And we can see on this image that the coaxial is visualized right next to this area of enhancement. The DynaCAD system automatically gives us the depth so that we can fire the needle 2 centimeters out of the coaxial device.
Remove the inner stylet. Rotating the thumb wheel changes the orientation of the sample basket, allowing sampling in different radial positions. Decide what clock positions to sample based on where the target is located relative to the coaxial. The optional prime button retracts the probe 20 millimeters, and the pierce button then advances it to more easily pierce through dense breast tissue. Here, Dr. Cranny fires for the first sample when in position by pressing the pierce button. The multifunction button initiates the biopsy sequence. The dual motion cutting easily samples through tough, fibrous tissue. Remove the probe and eject the sample into the sample container by pressing the multifunction button and then reset for the next sample. Continue to sample until sufficient samples have been gathered. The Vacora biopsy system provides exceptional sample quality. Larger, contiguous, non-fragmented samples result in better specimens for pathology. Some doctors will do a post-biopsy image to see if the cavity looks good or go directly to placing the ultraclip. We are using a barred MRI ultraclip marker. The clip is placed through the coaxial and hubs. Push the plunger to deploy the marker clip. Once the biopsy is complete, pressure will be applied to stop any bleeding and the opening in the skin is covered with a dressing. No sutures are needed. Confirmation images and a mammogram are performed to confirm that the marker is in the proper position. The self-contained design of the Vacora biopsy system gives exceptional handheld control. It is convenient to use with fast setup and cleanup for impressive procedure room efficiencies. The specifically designed MRI accessories result in precise needle placement, and the large intact samples collected result in a more confident diagnosis. Prior to performing MR procedures using the Vacora biopsy system, consult MR imaging equipment hardware manufacturer's information for use.